Hello, my name is Sanda Catala, and I'm a full-time faculty and a visual designer at Kent State University. My abstract is titled Going the Shortest Distance, Designing Research Frameworks for Reducing Translation Time in a Multicultural Language Tool. This project is a result of ongoing three-year collaboration between Rebecca Meehan in Health Informatics, Nicole Egbert in Communication Studies, myself, Sanda Catala, Dr. Chen Guan and Manisha Kumar in Computer Science, and Dr. Joel Davidson in Akron Children's Hospital. During 2016, approximately 85,000 adults and children fled their home countries to resettle in the United States. In general, immigrants have less access to healthcare resources, are in lower socioeconomic status, and are more likely to suffer from stigma and marginalization. In Summit County in Ohio in particular, the county's large public agencies currently spend a combined $865,000 on translation services annually. These local healthcare agencies invest a great deal of money on translation, spending more than the Medicaid reimbursement rate for medical services rendered. As cities expand their municipal resources for incoming refugees, the area of translation in healthcare and emergency services presents new challenges for visual design researchers. One such city, Akron, Ohio, in the last decade became a home to 5,000 Nepali refugees. Though Dzanga is the national language of Bhutan, there are 19 different languages and dialects spoken throughout the country. Though the future of refugee resettlement programs is uncertain due to recent global and political pressures, efficient transitioning of current newcomers into our local healthcare system can improve their physical, psychological, and social health outcomes, as well as reduce healthcare costs for everyone. This project will extend the investment of Akron Children's Hospital to facilitate newcomer intake processes and offset the potential healthcare disparities experienced by vulnerable populations such as these. Our team formulated a question: how might we streamline or shorten the time for the intake process for non-English speaking patients and their families by developing a digital language identification tool for healthcare providers? With all the translation tools currently available on the market, why would we need to develop another language translation tool? The rationale behind the translation tool is to help first responders and healthcare providers to quickly identify the language being spoken so that the correct translator can be called. Google Translate does not currently have Bhutanese Nepali in their database, though that may change in the days to come as they are continually making improvements. Also, that kind of tool may not be the best option in the context of healthcare emergency, because often a language needs to be identified in Google Translate before it can start translating. Our tool provides a way to identify that language, giving flexibility in how the next step can be provided, such as calling in a translator. Our tool provides an efficient solution to help responders get the right help more quickly and more effectively. Our user-centered design will be conducted with Akron City Translation Services, first responders, Bhutanese community, and healthcare providers. Our paper will focus on team assembly, defining the problems and challenges facing the Bhutanese families living in Akron and the medical community who serves them, and the design process. Within that design process, we will discuss design research framework, initiation kickoff, building prototype, ethnographic observations to inform design and establish context workflow, refining the design of the translation tool, and finally, testing the tool on site, funding, and dissemination of findings. Within the design process, we will be discussing methodologies and processes. such as qualitative data, user testing, model building steps, evaluation results, and challenges. Our project development, in our project development, we plan to employ human-centered design principles to leverage and increase the accessibility of healthcare information to multiple constituents, including clinical staff, first responders, and even refugees as end users. We argue that only by engaging these constituents in the development and design of a language identifier tool for health and social initiatives can a workable and sustainable solution be implemented. The final product, focusing on human-centered design, has the potential to save significant money and reduce time in resourcing the correct translators who decipher numerous Nepali dialects for refugees seeking hospital and emergency services in one community. Our initial prototype. When a Bhutanese family walks into Akron City Hospital emergency room, the intake department needs to quickly identify the language and call a translator on the premises to assist that family. Presently, this process involves an educated guess as to which translator is needed. Typically, translators charge around $37 an hour for their services. If the wrong translator arrives, the intake staff has to call in another translator to help the family in hope that this time they have the correct translator for the waiting family. The process is costly both in time and money, not to mention frustrating for the families waiting with a sick child to receive medical attention. We hope to develop a digital solution to listen to the initial phrase spoken in a certain language and then display to the healthcare staff member and the patient what language it is, using both visual and audio cues. Once there is the confirmation between patient and staff member, an interpreter may be called to help with the medical appointment. This process may also facilitate instructions for the patient as to where they should go and any additional instructions required in anticipation of their medical appointment. Our language tool is called STREAM, which stands for Smart Translation, Enabling, and Aiding Multicultural Populations. This is a beta interface, not designed yet. The result is displaying showing the strongest likelihood of the spoken language. We present the language in a rank order showing the percentages of other potential languages. It could be, as it is common for spoken words to develop and overlap with languages, especially as people move to different parts of the world and begin assimilating to that region. Our testing will include central processing employees, emergency staff, and community-based pediatrician's office staff. We invite comments and questions on this video at scatala@kent.edu as we head into fall 2020. Thank you.